Hey, great people. My name is John from Kenya Education Guide, and in this video we want to compare some two courses that you people have been asking us to do, the comparison thereof, that is clinical medicine and surgery and nursing. In other words, between clinical medicine and surgery and nursing, which is better? So if you are undecided about which of the two courses to do, you might want to watch this video to the end. And this is Kenya Education Guide. So let us start with nursing. What advantages or what do we like most about nursing? Now, there are two things we like most about nursing and which might make nursing an interesting option for you. Number one, nursing has many opportunities. If you compare it with clinical medicine, or in an institution you may find up to 10 clinical officers, and we are talking about some level 4 and maybe that kind of, that size of hospitals. There will be many nurses comparatively, because we need nurses at the emergency section, we need nurses at the wards, we need nurses even within the track sometimes. So if you compare the total number of nurses employed in a medical institution vis-a-vis the number of clinical officers, it's apparent that more nurses are usually employed compared to clinical officers, and that means nurses have more opportunities. There is a bigger likelihood for you to get a job faster as a nurse compared to a clinical officer. In fact, if you are a good nurse, you have chances of working even outside the facility. If you strike a rapport with the patients that come to you, and they need some nursing services at home, like those terminally ill, you'll be able to connect with them, go to their homes, attend to them at an extra pay. Remember, as a nurse, you can work in hospices, you can work in homes of aged people, you can work in rescue farms, rescue organizations like Red Cross, St. John Ambulance. So nurses, I think they have a bigger spectrum of opportunities compared to clinical officers. So the first advantage, or the first thing that we love about nursing, is there are more opportunities relatively across the board compared to clinical medicine, clinical medicine and surgery. The other thing, and it is related to what we just said, is that if you do nursing, because nurses are not just in demand in Kenya, they are in demand even outside Kenya. Chances are, if you play your cards right, connect with the right organizations, the right employers, you may go work to the diaspora. Nurses keep flying out to the UK, to the USA, to the Australia. They go to work there, and there the rates are way better. So where you may be okay working locally, if you are ambitious, there is a better chance for you as a nurse outside there compared with clinical medicine. Yeah, so two things about nursing you have most: more opportunities, and that includes a chance to work outside Kenya more easily compared with clinical medicine. What we may not like about nursing is first, you really get tired. You know, nurses work for long hours. There's a lot of work for nurses, from attending to patients in the wards, in the emergency. Nurses are all over, performing instructions that they get from clinical officers and doctors. So, yeah, you may be working for long hours, and that is potentially one of the problems. If you go for nursing, sometimes you can get very tired. And maybe the other one is you will never become a doctor. Once you go to nursing, you are basically an assistant, so you never become a doctor. There's no path that you can take unless you change the course, and which means you need to have the grades for you to become a doctor. The best you can is, you know, some of the patients will be calling you sister. Yeah, they will call you sister, but if you would like to become a doctor, not with nursing. But I think that is really not a big deal. Or is it? Let us now speak about clinical medicine as a good course, yes. But what are the advantages if you compare it with nursing? The first one is you get paid more, slightly more compared to nursing, because for nurses the pay is about 65k, 55 to 65k depending on where you are working. But for CEOs, clinical officers, it will go up to 80k at the start, of course, again depending on where you are working. So comparatively, as a clinical officer, the pay is slightly higher. The other one is there is prestige, a bit more prestige if you look at it from that angle, and that's because when people meet you at the track, they call you the doctor. So some people want to feel nice being called a doctor, even though you are not really a doctor, because you are a clinical officer. There's that feel good option when people call you good morning doc. I think it can be a nice thing. The other key advantage is you don't do a lot of work. So clinical officers don't get as tired as nurses. Yeah, you know for long hours, but sometimes, it's not always. And again, you know, if you compare the two, you don't have so many things you are doing at the same time as nurses do. You know, that nurses have to serve so many people throughout the day in different conditions. But for as a clinical officer, you just diagnose, give instructions to the nurses on what to do if there are some tests to be done. You just prescribe medicine, and the nurses will do the rest. So you don't sweat a lot compared to nurses. On the downsides, when you come to clinical medicine, there are two things that are a concern. The first one, the course is getting flooded. This is what happens. You know, when people miss out on MBCHB, that is medicine and surgery degree, because it's very competitive. most of them turn to clinical medicine and surgery, believing that it will make them doctors, which is not really the case. There are two different courses, because you still essentially become a clinical officer. So whether you do a diploma or a degree, you are essentially a clinical officer. Even though with a degree, you may teach people who are doing diploma. But essentially, in terms of the functions, you do the same. So the first problem is being done by those people who miss out on the medicine degree. Number two, a lot of people are doing it at KMTC. So the two courses, nursing and clinical medicine, are the two which are taken by many people. So there are a lot of people graduating from KMTC with the same course. So it's kind of getting flooded, and people are starting to tarmac for some time before getting work. And the other major concern is that clinical medicine and surgery is not known outside Kenya, Uganda, and Tanzania. So it's basically a local course, if I would use that word. So if you tell people in the UK, in the US, that you have done clinical medicine and you want to apply to work there as a clinical officer, they don't really know what that course is. So you are basically localized, unlike nursing, where you can go to the diaspora and work there still as a nurse. So in terms of flying out, in terms of opportunities in the diaspora, clinical medicine will be defeated. Comes number two to nursing. So those are the pros and the cons of each, and it's upon you to decide. Remember, as always, the very important thing is to follow your passion and interest. So while it's good to be aware of what is good with a certain course and what could be an issue with a certain course, it's also very important to make sure that what you select is in line with your passions and interest. So follow your heart, follow your passion, follow your interest. The other thing is also personality. So as you follow your passion and interest, in terms of choosing between these two courses, also your personality matters. So are you a person who don't mind seeing blood from the morning to the evening, attending to woods, cleaning ill people, people who are not able to help themselves, patients, some of them critically ill? If you don't like that, nursing is good for you. But if you don't find that very appealing, probably you can get an escape route through clinical medicine, even though sometimes it has similar scenes. So follow your heart, follow your passion, know your personality. Otherwise, those are the pros and the cons of the two courses. Choose wisely.